Hello, I'm Catherine Scott Moncrief. This is Step by Step, where we take practitioners through important veterinary conditions and issues step by step. This algorithm will walk you through the diagnostic and treatment approach to a cat with newly diagnosed diabetes mellitus. This episode of Step by Step is sponsored by Boehringer Ingelheim, the makers of Semvelgo. Semvelgo, veligliflozin oral solution, is indicated to improve glycemic control in otherwise healthy cats with diabetes mellitus not previously treated with insulin. The starting point for this step-by-step guide is a cat presenting with possible diabetes mellitus. These cats typically present with clinical signs of polyuria, polydipsia, polyphagia, and weight loss. The diagnosis of diabetes is confirmed by documentation of a persistently elevated blood glucose and the presence of glucosuria. After establishing that a cat does fit the criteria for a newly diagnosed diabetic, the next step is to determine whether there are indications of other concurrent illness. If the patient is dehydrated or cachexic, or has other abnormalities on physical examination, such as inappetence, vomiting, diarrhea, lethargy, or abdominal pain, the cat should be further evaluated, and the diabetes should be treated with insulin. Other abnormalities that indicate the presence of concurrent illness include abnormal thoracic auscultation, a palpable thyroid nodule, or organomegaly. Cats with evidence of concurrent illness or ketoacidosis are not good candidates for treatment with an SGLT2 inhibitor. If the patient has a normal physical examination and is eating and drinking well, the patient may be a good potential candidate for treatment with an SGLT2 inhibitor such as Semvelgo. The next step should be to perform further diagnostic testing to rule out ketosis or ketoacidosis and to further investigate for concurrent illness. Testing should include a complete blood count, a chemistry profile, a urinalysis, measurement of total thyroxine concentration, and ideally measurement of blood ketones such as beta-hydroxybutyrate, which we abbreviate as BHB. Cats that are good candidates for Semvelgo should not have laboratory abnormalities indicative of hepatic disease, should have a serum creatinine less than or equal to 2 mg per deciliter, and should have no evidence of other concurrent illness. The urine ketones should be negative in the urine, and the BHB concentration less than 2.4 millimole per liter, which is 25 mg per deciliter. Cats with baseline creatinine between 1.6 and 2 mg per deciliter when Semvelgo treatment is started should be closely monitored for signs of volume depletion, dehydration, and body weight loss. Renal function should be monitored within the first week of treatment initiation, and then according to standard chronic kidney disease guidelines. Semvelgo has not been evaluated in cats with baseline creatinine greater than 2 mg per deciliter. Diabetic cats with evidence of concurrent illness, ketosis, or ketoacidosis should be treated with insulin. In these cats, the recommended monitoring protocol should be discussed with the owners. And if they agree to the treatment recommendation, the cat should be started on Semvelgo oral solution at a dose of 1 mg per kilogram orally, given at a consistent time of day with or without food. After starting Semvelgo, cats should be carefully monitored to make sure that they do not develop adverse effects. To monitor for the development of ketosis or diabetic ketoacidosis, cats should be re-evaluated on days 2 or 3, 7, and 14 days by performing a complete history, physical examination, body weight and body condition score, blood glucose, urinalysis, and ideally blood BHB concentrations. So to measure BHB, you either need to send blood or serum to a reference laboratory, or you need to purchase a point-of-care ketometer. Point-of-care ketometers are cheap and easy to obtain, but if a practitioner doesn't have a point-of-care ketometer, then it is possible to manage these cats by measuring urine ketones. But a point-of-care ketometer allows you to measure BHB, and that allows you to have a more sensitive indication of ketosis or ketoacidosis. So you might perhaps identify ketosis or ketoacidosis earlier than you would by measuring urine ketones. If at any of these time points the cat develops signs of systemic illness, such as anorexia, vomiting or diarrhea, the treatment should immediately be discontinued and the cat transitioned to insulin treatment. Cats with positive urine ketones or a BHB greater than 2.4 millimole per liter should also be immediately transitioned to insulin. Cats with ketoacidosis should be treated with insulin, intravenous dextrose, nutritional support, and supportive care. If the BHB is greater than 1 millimole per liter, but less than 2.4 millimole per liter, the value should be rechecked in 24 to 48 hours. And if the value continues to rise, the cat should be transitioned to insulin. If after the first 14 days, the cat is doing well clinically, and there are no indications of ketosis or ketoacidosis, the next recheck should be scheduled at 28 days. At this recheck, as well as monitoring for systemic illness or for ketoacidosis, glycemic control should be assessed by assessment of clinical signs of diabetes and measurement of blood glucose and serum fructosamine. If at the 28-day recheck, the clinical signs of diabetes are well controlled, the glucose is less than 250 milligram per deciliter, and the fructosamine is within the reference range, the treatment should be continued and the cat evaluated another 3 months or whenever signs of illness are detected. If the clinical signs are controlled, but the glycemic targets are not met, the cat should be evaluated in a further month. If after a further month of treatment, glycemic targets are still not met, the cat should then be transitioned to insulin. At every monitoring recheck thereafter, it is recommended that clinical signs, body weight, body condition score, blood glucose, urinalysis, serum fructosamine, and blood ketones are measured to make sure that cats are still responding appropriately to treatment. If at the 28-day recheck, neither the clinical signs nor the glycemic targets are met, the cat should immediately be transitioned to insulin treatment. Thank you to Boehringer Ingelheim for sponsoring this edition of Step by Step. For more information on feline diabetes mellitus, check out vetfolio.com or cinvelgoclinic.com.
Important safety information. Cinvelgo, vilaglyphosine oral solution, is indicated to improve glycemic control in otherwise healthy cats with diabetes mellitus not previously treated with insulin. Before using this product, it is important to read the entire product insert, including the boxed warning. Cats treated with Cinvelgo may be at an increased risk of diabetic ketoacidosis or euglycemic diabetic ketoacidosis, both of which may result in death. Development of these conditions should be treated promptly, including insulin administration and discontinuation of Cinvelgo. Do not use Cinvelgo in cats with diabetes mellitus who have previously been treated with insulin, who are receiving insulin, or in cats with insulin-dependent diabetes mellitus. The use of Cinvelgo in cats with insulin-dependent diabetes mellitus or the withdrawal of insulin and initiation of Cinvelgo is associated with an increased risk of diabetic ketoacidosis or euglycemic diabetic ketoacidosis and death. Sudden onset of hyporexia, anorexia, lethargy, dehydration, or weight loss in cats receiving Cinvelgo should prompt immediate discontinuation of Cinvelgo and assessment for diabetic ketoacidosis, regardless of blood glucose level. Cinvelgo should not be initiated in cats with ketonuria, ketonemia, pancreatitis, anorexia, dehydration, or lethargy at the time of diagnosis of diabetes mellitus, as it may indicate the presence of other concurrent disease and increase the risk of diabetic ketoacidosis. Keep Cinvelgo in a secure location out of reach of children, dogs, cats, and other animals to avoid accidental ingestion or overdose. For more safety information, please refer to the package insert or visit cinvelgoclinic.com.